This is the second video of history taking. In the previous video, I have explained the patient particulars, chief complaint, and I was talking about the history of present illness. If you haven't watched the previous video, then you can go and watch the part 1. Now, continuing with the history of present illness, I have explained about the fever. Now, if the patient is presenting with abdominal pain, so for abdominal pain, how we write that uh, history of present illness is already started with the patient was apparently well 3 days back. Now, for the continuation, how we should write, like we have to mention that patient also complains. Patient also complains of abdominal pain. Of abdominal pain. Patient also complained of abdominal pain in which region? In right, in right upper region, which is insidious in onset, which is insidious in onset, progressive, and it is dull aching type, and it is not radiation, and it aggravates on taking food and relieved on taking antacids and relieved on taking antacids. Actually, antacids, it is the medical term. So I think we should avoid this term antacids, and we have to write just and relief on taking medication. We have to ask the name of the medication. If the patient mention like pantoprazole, omeprazole, then we can mention like in bracket pantoprazole or omeprazole. But if the patient do not know the medication, we have to write patient do not know the name of medication. Okay, and pain is usually 5 by 10 on severity and associated with water breath or nausea or vomiting. If anything it is present, we have to mention. Okay, so from this we have explained the chief complaints in the history of present illness. So is this the complete history? No, we have to rule out the systemic illness also. Okay, so here what we are seeing that the patient is having fever and the patient is having abdominal pain. So the cause is most likely the abdominal cause. Okay, so while taking history, what we have to mention that my approach is in a way like first I explain the chief complaint. Okay, first I explain the chief complaint. Then what I do, I made a uh, system which system is involved. Okay, so if abdominal system is involved, then I will ask the history of abdominal symptoms. Okay, so asking symptoms related to system, which system is involved, you know. Then after this I rule out other systems. Okay, like abdominal system is involved, there can be association of respiratory system, GI system, cardio system, urinary system. Okay, so in the third step I rule out other systems. Okay, then I also ask about the complications. Okay, and then finally in the fifth point, I ask the history for tuberculosis and malignancy. So these are the 5 points which is very important for me to take history, so that I cannot miss any point. Okay, so if we look these points, I have completed this chief complaint. Okay, the chief complaint is explained, but the symptom associated to the GI system is not completely explained. So what I do to I rule out the symptoms, like I ask the patient, is there any history of, is there any history of, like if there is abdominal pain, okay, is there any history of abdominal swelling, okay, abdominal swelling, okay, and is there any history of uh, black color stool, black blood in stool, blood in stool, okay. Then I also ask about constipation, any symptoms related to the GI, constipation, and then diarrhea, okay. I have to ask this. From this my GI system is ruled out. Now to rule out other systems, to rule out other systems, there is one practice in our hospital, like in the medicine and surgery group, if the chief complaint is just the fever and abdominal pain, then the differential diagnosis which I made from this fever and abdominal pain, only that history should be ruled out. Okay, but in the pediatric, we have to rule out all the system, because any system can be involved in pediatrics. So for the medicine and surgery, we have to rule out only the differential diagnosis, and no other systemic illness is necessary to rule out. But in pediatrics, every system should be ruled out. So I will write in a pediatric approach. So let's begin. So how does it start? It start from like if we consider this is a man, okay, man is laughing. This is ear, okay. So in this, starting from the first, so I will ask the history of ear, nose, and throat, ENT. So how will we ask? I will ask like, is there any history of ear or nose discharge in sore throat? If there is any history related to this, then there is a chance of ENT involvement. Okay, so ENT has been ruled out. There is no history. Then I will come to the chest. In chest, what are the symptoms? So in chest, the symptoms can be like history of. We have to ask of history of cough, chest pain. Just 2 3 points. Not no more necessary. No more points are necessary for this. Just 2 3 points like history of cough, chest pain. Okay. Uh, difficulty in breathing, difficulty in breathing. So from this, the respiratory system is ruled out. Now, in third, we have to ask about this a beautiful heart. So for heart, what we have to ask? History of leg swelling, history of leg swelling. Okay, chest pain. We have already asked it, but also it is necessary to mention here. If I have mentioned here uh, chest pain in the initially, then there is no need to repeat this chest pain. Otherwise, the teacher will be so much irritated that you have mentioned early and you are also again mentioning this point. So if it has been asked already, do not mention it. So history of leg swelling, chest pain. There is also history of cough in the cardiac cause. So if it is asked, we do not mention. Okay. Now, what is also ruled out? Now, urinary bladder. For urinary bladder, we have to ask like history of uh, urgency, frequency, and and pain during menstruation. Okay. So I have to ask the history of this urgency frequency and any pain during menstruation. And in the fourth point, uh, to rule out any systemic illness, uh, any history of malignancy, we have to ask the history of, like, uh, weight loss, history of weight loss. So how will we ask that history of weight loss? We ask the patient that the cloth which has been fitting you in the earlier 1 year back, this clothes has been loosened, or this clothes has been more tightened up. If the patient says that uh, his clothes are loosened since 5 6 months, then we can guess that yes, the body size is approximately decreasing. So there can be history of weight loss. One way is to assess the weight loss in that way, and another is the if the patient can recall the weight which was taken before this systemic illness, this complaint, like 1 year 2 year back, and then comparing with this recent condition, weight loss, weight, then if there is a difference, then uh, we can assess weight loss. But these are asked, how much weight loss is significant? How much weight loss is significant? So if there is weight loss of 10% in 6 months, then this is the significant weight loss. Okay, so for example, if the patient weight was 60 kg 6 months back, and now he is 52 kg, now he is 52 kg, so difference is how much? 8 kg. And the 10% of 6 kg is 60 kg is 6 kg. So um, 6 months back, so in the 6 months back, there is a weight loss of 8 kg in comparison to 6 months back. So it is more than the 10%, more than the 6 kg. So this is the significant weight loss. If patient is having 60 kg in past 6 months and now he is having 52 kg, then there is difference of 8 kg and 6 kg is 10%. So 8 kg is more than 6%. So there is significant weight loss. So for a history of malignancy, we have to ask this history of weight loss and any history of fever. Okay, these 2 points are necessary. And for tuberculosis, we have to ask a history of fever, evening rise of temperature. Okay, fever, evening rise of temperature, weight loss. It is also necessary in this. So, in this way, we ask the tuberculosis and malignancy. We have also ruled out the other systems. Now, one point is also we have to ask about this autoimmune conditions. So for that, we ask the history of like joint pain. Is there any history of joint pain? Okay, uh, and then in case of female, there can be history of SLE, SLE related symptoms. So we have to ask about the malar rash, not just write the rashes. History of joint pain, rashes. If a teacher asked, why did you take history of joint pain and rashes, then we can say that to rule out the autoimmune conditions. Okay. So similarly, fever, evening rise of temperature and weight loss, it is for tuberculosis. Weight loss and fever, it is for malignancy. Urgency, pregnancy and pain during maturation, it is for any urinary related symptoms. UTI, for example, like UTI, leg swelling, chest pain and cough. For CNS, sorry, for chest, for this uh, respiratory system, sorry, for this uh, cardiac system, and cough, chest pain, difficulty in breathing, it is for respiratory system. Okay, I forgot to mention the CNS. So for CNS, just ask a history of headache, any there is any history of headache, neck stiffness. Okay, to lot the meningitis. Okay, these are these points which we have to mention in the history of present illness to lot the systemic illness. Okay, and for complication, how will we assess that? Like, if patient is having abdominal pain and fever, then the patient might not be taking any fluids or foods, during which the patient can be dehydrated. So if the patient is being dehydrated, then there can be complications. So during these conditions, we have to also ask about the complications. Okay, so in this way, our history of present illness will be completed. Now, after history of present illness, we have to ask the history of, in the fourth point, we have to ask the history of past illness. Any history of past illness. Okay, so in history of past illness, in some hospitals, it has been practiced that after mentioning this history of present illness, what they usually prefer to do, they want to listen the history. Uh, if the patient is in the ward, then the teacher want to listen the history, that when the patient is get admitted into the ward, or when the patient visited the OPD, then what has been done to the patient. It's like some saline has been given, and some medication has been given. Then patient shifted to ward. Then investigations were done. Some teacher prefer such types of sentences in the history of present illness at last. But I think if we do not mention such conditions, then also it will be fine. But if teacher prefer, then you have to mention that what has been happened in the after getting admitted to the hospital or after visiting the OPD. Okay, so now in history of past illness, what we ask that, is the patient having similar complaint in the past also or not. So is patient having similar complaint in past or not? Similar complaint in past or not. Okay, in the first question is that, and the second question is patient having, is patient suffering from, is patient suffering from tuberculosis, okay, diabetes mellitus, and hypertension. Okay, these three are the most important points which we should never miss. So in history of past illness, in medical history, we have to ask these three symptom, okay, for medicine purpose. And in surgical history, has patient undergone any surgery? Has patient undergone any surgery? So these are the 3 points which we have to ask in history of past illness. That how will be present to the teacher, like the patient, there is no any similar complaint in past, and the patient is no and the patient there is no history of tuberculosis, diabetes mellitus, and hypertension, and there is no surgical intervention done in the past. In this way, history of past illness is mentioned. Now, in the fifth point, we have to mention about the family history. Okay, we have to mention about the family history. So in family, what we have to know, that is there any similar complaint in the family or not? Is the any family member is suffering from tuberculosis, diabetes mellitus, or hypertension or not? Or is there any surgical intervention which is done in the patient family member in the past or not? So these are the three important points which we should ask in the family history. Okay, and in some case, the family in a family history, we have to mention the family tree. Okay, we have to draw a family tree. Family tree. In family tree, the male are represented as this rectangle and female are represented as circle. Okay, so I think uh, we should not discuss this family tree. Just let's talk to the next point. The sixth point is the personal history. During personal history, what we have to ask, we have to ask the around five important points. The first one is patient having veg or non-veg diet? Okay, and is patient appetite good or not? Is patient appetite good or not? And is sleep pattern disturbed or normal? Is sleep pattern disturbed or not? And then fourth one is there any is there any bowel or bladder problem or not? And the last point is the history about smoking and alcohol. So we have to ask patient about smoking. So does patient smoke or not? Does patient smoke or not? And or does he consume alcohol or not? So this is one of the most important history which we should never miss. So uh, starting with the personal history, how will we present that? We will present like the patient is having good appetite. Just listen. The patient is having good appetite and eat mixed diet, and his sleep pattern is normal, and there is no any bowel or bladder complaint, or bowel bladder is normal, and the patient do not smoke and do not consume alcohol. In this way normal patient present. But if the patient smokes, then how will we write? We have to write like in the form of smoking index. Now we have to know that how to calculate the smoking index. So for index, yeah, and smoking index, we have to know that how many number of cigarette smoked per day. Okay, how many number of cigarette smoked per day into duration of smoking in years. So in this way, smoking index is calculated. But what we need in what teacher expect to know, that is the pack year. How many pack years? Okay, how many pack years? This is the most important one. So for pack years, what we have to know, how many number of cigarettes per day divided by, in one packet of cigarette how many cigarettes are there? So there are 20. So number of cigarettes per day by 20 into number of years smoked. For example, if the patient smoke 10 cigarette per day, then 10 divided by 20, 10 cigarette per day, and he smoked for 20 years. He smoked for 20 years. So 20 cancel equals to 10. So this is 10 packets. So during presentation, what we have to say that the patient smokes 10 cigarettes per day for 20 years. That is 10 pack year. In this way, we have to write the patient about smoking. Now, talking about this alcohol. So for alcohol, we have to know how many units of alcohol uh, does the patient is smoking. So uh, let's simplify. 1 unit of alcohol means 10 grams. How many grams? 10 grams. Okay. And different companies like beer, cider, wine, and then this local homemade, they have different uh, concentration of alcohol. So we have to calculate uh, every company, every brand, every concentration in unit. Okay, so let's first know how many units in how many grams, or how many percentage are present in the different brands. Like for example in beer, in beer, how many percentage are there? There is 5% alcohol. Okay, there is 5% alcohol. And in wine it is around 15%. Okay, then uh, if we talk about uh, vodka, gin, rum, whiskey, they contains around 40% of alcohol. Similarly, the homemade alcohol, the homemade alcohol, they contain alcohol around 15 to 40%. Based on what we have to know? if the alcohol is made in the homemade, either it is distilled or it has been boiled or fermented. So based on the process of making alcohol, the percentage of alcohol in homemade differs. But it is when we talk about homemade, we usually take around 15%. Now, for example, if a patient drinks this beer, if patient drinks beer 1000 ml beer, 1000 ml beer means 1 liter beer per day, then how many unit of alcohol is he drinking? So we know that we know that one 100 ml beer contain how many ml alcohol? 5 ml alcohol. Okay, 5 ml alcohol. Like this beer contains 5% alcohol. So 100 ml beer contain 5 ml alcohol. Now patient drinks how much beer? 1000 ml. So 1000 ml means 50 ml. 50 ml alcohol. So the 1 unit of alcohol is around 10 grams or 10 ml. Okay, let's make easy. So 50 ml alcohol means 10 ml means 1 unit, and 50 ml alcohol means 5 unit. So in this way, if a patient drinks 1000 ml beer or 1 liter of beer per day, then he consumes 5 unit of alcohol per day. Now we have to know that how much alcohol is safe for a patient. So it is different for male and female. In male, less than 3 unit alcohol is safe, and in female, less than 2 unit alcohol. 2 unit alcohol is safe. It doesn't mean that you start drinking alcohol. It means that less than 3 unit of alcohol in male and less than 2 unit of alcohol in female, that amount of alcohol can be metabolized by our liver based on its capacity. But if the patient starts drinking alcohol regularly, then there will be obviously a problem. So this is not a good saying, that if patient present to the doctor and ask to drink alcohol, do not say that this 30 unit of alcohol, 30 ml of alcohol is safe, you can drink. Just restrict him. Okay, just restrict him. So we have to know that more than 3 unit of alcohol and more than 2 unit of alcohol in male and female respectively, they are hazardous for drinking. So in the personal history, we have to mention this type of points. Now in the seventh point, what we have to mention that in the history, we have to mention about socioeconomic history. Socioeconomic history, like a patient is living in a either katsa or pakka house. Okay, patient is living in a katsa or pakka house, and is there any overcrowding or not? Okay, over this socioeconomic history is not so much important, but we can write overcrowding or not, and how, from what source they're drinking water. Okay, from what source water drinking, and is there the separate toilet or not, separate toilet or not. So this actually tells about the socioeconomic conditions. Now in the eighth point, we have to ask about the drug and allergy history. Drug and allergy history. For this, there are some drug like ceftriaxone, penicillin. They can cause the anaphylactic reactions. Okay, so we have to ask the patient that the patient is having any history of allergy to any drug or any dust, pollen grains. Okay, any food. In this way, so when patient is asked, how will we present that? There is no history of allergy. There is no history of allergy to any drug or food or pollen grains till date. We have to mention till date. If the patient is having allergy to any drugs or any medications, then what we have to write? We have to write like there is history of allergy to drug or medication, but the patient do not know the name of the medication. Okay, and also we can add that, but documentation is not done. If patient is having allergy and it is documented, then only we have to we have right to say that patient is having allergy to this drug. But if that is not documented, we cannot say. So these things should be remembered. And also you have to mention that there is there any history of any long-term medication? So if like no long-term medications medications like steroids, okay, like steroids, antidepressants, because the antidepressants can also be taken for 6 months or 1 or 2 years. So we have to mention that also. Any steroids, antidepressants, uh, any medications for like tuberculosis, okay, like in malignancy, we have to mention that. So if there is no any history of medications, you can simply write there is no history of long-term medications. Okay, fine. Now in the ninth point, which is very important, if the patient is female, we have to mention the menstrual history. We have to mention the menstrual history. Just in short, what we have to ask is that are the periods regular or not? Are the periods regular or not? And last menstrual date, last menstrual date, and um, how many days of bleeding, how many days of bleeding, and how many pads used to be soaked, and how many pads used to be soaked. So in medicine and surgery, just we have to write about this menstrual history. And in pediatric, like if age is 15 and menstruation has been started, then only it is necessary to mention. Otherwise, this menstrual history is not needed in pediatric history. But in medicine and surgery, this if the patient is female, then we have to mention this menstrual history. It should not be missed out. Okay. So by this, the part of history taking is completed. Hope you enjoyed the video, and please make me know if there is any confusion related to history taking, and suggest me to make the next video in which topic, and any advices will be heartily welcomed. Thank you so much. Share this video to your friends and subscribe the channel, as you know, blah blah blah. Thank you so much.